Hello students, today in this table Viva, we will learn about the obstetric and gynaecological. So as you can see on the table, this many instruments, stethoscope and this medication, all these things will be placed on the table. Now we will go one by one through all the instruments and the articles that are kept on the table. So we continue with the Sims double-bladed posterior vaginal speculum. Okay. So this it allows the wider area for inspection and it is not self-retaining. Okay. When we use these instruments, you require an assistant to hold this in position. So let's see its parts. It has two blades. Okay. One blade is broad and the other blade is narrow. So the broad blade is used in multiparous woman and the narrow blade is used for the nulliparous woman, and this is the handle. Okay. So this way it is introduced into the vagina, and thereafter we see its uses. It is used for retracting the posterior vaginal wall during various procedures like DNC, dilatation and curettage, DNE, that is the dilatation and evacuation, and also for taking biopsy from the genital tract. And also when we want to insert and remove the copper teeth, that time also we can use this. When we do the vaginal hysterectomy, that time also this instrument is used. And for in OPD routine vaginal examinations, we use this. In cases of any neoplasm is suspected or ulceration or cyst, so that time this is being used. Okay, whenever we use this instrument, along with this, we always the second one goes the anterior vaginal wall retractor. Okay, so this is the Sims double-bladed posterior vaginal wall speculum. And this instrument is anterior vaginal wall retractor. So these both goes hand in hand. If you use this, you require an assistant to hold this. And then with the one hand, you hold the posterior vaginal wall, and with this anterior lip of the cervix. Okay, so this way both it is going hand in hand. This both instruments are required when you use this. Okay, so this it has the oval fenestrations. Okay, here can you see the end with the transverse serration is there. So this is oval fenestrated ends. Okay, with there are the transverse serration. Okay, but I am holding that is the handle. So both the side equal. Okay, so this can be used with the Sims speculum to retract the anterior vaginal wall. To visualize the cervix and the anterior fornix. It is also used as the blunt curative. Okay, so this transverse serrations there are blunt. So as a blunt curative also we can use. So this is the oval fenestrated oval shaped fenestration with the transverse serration. So this instrument is anterior vaginal wall retractor. Fine. Now next we will go third. This is the Cusco self-retaining vaginal speculum. Okay, this instrument. So this is known as the Cusco's bivalve. It has two self-retaining. So this was not self-retaining, whereas this is self-retaining. When we use this instrument, you do not require an assistant. Okay, so it is the self-retaining type of speculum, and it has two hinge blades. Okay, two hinge blade which can be opened up and adjusted at the various angle. Okay, so this way when we want to introduce, so you close and then you open into the cervix, vagina, and then slowly open. It has a screw. So by means of screw, you lock it or you adjust this. Okay. So this is the hinge screw and this part is handle. Okay. So this looks like this. This is the handle and two plates. Okay. And this is the hinge screw. So the advantage is that being self-retaining speculum, it does not require an assistance. Okay, when we use this, it can retain by itself. No need an assistant. It is easy to use. It gives good exposure, okay, to the cervix, and it causes very less discomfort to the patient. It can be used to take the cervical biopsy, also visualization of the cervix or vagina, to collect, to insert intrauterine contraceptive devices or to remove IUCD, then to collect any specimen. Then when we use the colposcopy, that time also in that procedure we can use this. Then to diagnose incompetent os, we can use this. To detect antepartum hemorrhage also, or we want to take pap smear or checking of the ruptured membrane, or in minor or major gynecological procedure we use this. What is the disadvantage of using this instrument? So it occupies the anterior and posterior vaginal wall, okay, completely. So visualization is very narrow, so only this much you can visualize, other all is covered with this two plate, and so very narrow space for the visualization, only this much space for the visualization is available. So that is the only disadvantage. Okay, so this is cuscous bivalve self-retaining vaginal speculum. Fine. Third, next we go to the valsellum. Okay, so this heavy metallic instrument, a type of forceps. Okay, can you see? Okay, so this is used to hold the anterior lip of the cervix when it is not friable, means in non-pregnant uterus only we can use, because in pregnancy, okay, it becomes very soft. So that time it is the traumatic, that can be heavy bleeding, and therefore we cannot use this. Okay, so parts, it has the sharp teeth. Okay, can you see the sharp teeth? Okay, and then this is the curved blade. See, it has the curves. Fine. Then there is the joint. This is the joint, and sharp. Okay, it has ratchet lock. This is and finger bow. Okay, so this is the sharp teeth. Okay, can you see the sharp teeth? Okay, then curved blade, joint, sharp, ratchet lock, and finger bow. What are the uses of valsellum? Okay, so valsellum is used for holding the anterior or sometimes even the posterior lip of the cervix in various procedures. Okay, for example, in DNC, in cauterization of the cervix also it can be used. It can be also used to bring down the fundus of the uterus when we perform the vaginal hysterectomy. Then also it is used to hold the cervical lip for procedure. Okay, and then grasping small fibroid in myomectomy. So for all these purpose we can use this. In place of this, okay, this is very traumatic. In place of this we can also use the Alice forceps. So this was the valsellum. Okay, valsellum, the full instrument. Right. Next we will see ovum forceps. Okay, this is ovum forceps. So this is specially designed. Okay, the parts of this, there is the cup plate. Okay, so can you see there is the cup-like structure on the plate, and it has the linear fenestration. Okay, so there is fenestration and opening. So whatever tissue we hold, we catch, okay, that can be bulged out. Okay, from this fenestration, from this opening, the extra tissue can bulge out, and the trauma or the injury can be minimized. Okay. So the forceps with the cup plate with linear fenestration, the shape of the plate allows to hold the reasonable amount of the tissue. Okay, as I said that some tissue we can hold without giving any damage. So the uses of this, when we want to remove the product of conception, no? For example, in incomplete abortion, inevitable abortion is there, we want to remove the product of the conception, that time we can use. Also for removing the retained membrane, no, from the uterus after the delivery. Some membrane remain inside and you can hold, and very peacefully in rotation movement you can remove with this. Also for removing any foreign body from the uterus, this is used. So this is ovum forceps. Okay, fine. Next instrument we will see the uterine sound. So this is uterine sound. Okay, as can you see, it is like long rod-like structure. So this is metallic strap about 12-inch long. Okay, how much is the length? 12 inch. So this is there are marking or the graduated measurement is there on that. So it makes easy for us to know how much we have inserted in. So it is used to sound the uterus as the name says. Then also to measure the length and direction of the uterus. So the length is important to know in cases of when we want to insert the intrauterine devices. No? So that time we insert and we know how much is the length. And thereafter, so that what will happen with that, the rupture or the penetration of the uterine of the uterus can be prevented, or the injury. Sometimes if without knowing we just insert copper, it can traumatize the uterus. Then also it acts as an initial dilator. Just first time you want to dilate the cervix, that time also it can be used. So the parts of that, the tip, the tip is blunt. So we can say blunt tip. But I am holding, this is known as the handle. Okay, handle, and this is the shaft. Okay, the tip is blunt, so that the trauma to the uterus is prevented. Okay, so the initial end is curved this much, or angle. So this is the nearly 2 inch it is long. The curved, the angle part is 2 inch long, and this we can never use in pregnancy is suspected. Okay, or in cervical infection is present. In this, these two are the contraindication. In that condition we should never use when pregnancy is suspected. Why not to use? Otherwise it will damage the fetus that is inside. So this is the uterine sound. Fine. Next we will see the Hagar's dilator. Okay, Hagar's dilators comes in this type of set. Okay, so this is the full set of Hagar's dilator. Can you see? We always start with the smallest size. Okay, so this is named after. This is known as the double-ended Hagar's dilator. Why double-ended? From both the side you can insert. Okay, both the side the size matters. Okay, and one side you insert the smallest size. It starts with the number 3. From number 3 it goes up to 18. Okay, so this is the largest dilator. Can you see? So this is the smallest number 3. It starts with the 3. It can goes up to 18. So the numbers are graduated or marked on the Hagar's dilator. Okay, so these are the metallic instrument. It is used for the dilatation of the cervix. When we want to dilate the cervix, we use this, especially in the pathological condition where we need to approach the uterine cavity through the cervical canal. Okay, so this is the double-ended Hagar's dilator. And there is also one more type, that is the Hawking-Ambler dilator, that I do not have it here, but it has only one single end. Okay, it is not both the sided. Here there is the holder and then just to insert this way. So the uses of this to dilate the cervix during the gynecological procedure. When certain procedure we do, that time we want to dilate the cervix there. Also in DNC, dilatation and curettage, dilatation and evacuation. For MTP also we can use when there is incomplete abortion. We can use this to dilate the cervix. Also in the drainage of the pyoderma, or in operation of the cervix repair or cauterization of the cervix we can use. Okay. So what are the complications of this? No complications, sepsis can occur, hemorrhage can occur, or perforation of the uterus also can occur with this, or the cervical tear also we can it can cause. So this is used with the cautious. Okay, so this is the Hagar's dilators. Fine. Next we will see the simple curettage. Okay, uterine curettage. Okay, so uterine curettage is Horizontally it looks like the anterior vaginal wall retractor. Okay, but after I'll tell you what is the difference between both. So this is the uterine curettage. So it is surgical instrument designed for scraping the biological tissue and debris for the biopsy or excision or the cleaning procedures. Okay, it has two ends. One end is blunt. This is blunt end. Okay, one end is blunt. Another one is the sharp end. Okay, sharp end is used for the gynecological procedure, and the blunt end, in case blunt end is used for the pregnant uterus. Okay, when you want to do DNC, DNE, that time we use this. In surgical MDP is there, we want to remove the product of the conception, that time the blunt end is used. Okay, so this is the uterine curettage. So what is the difference between anterior vaginal wall retractor and the uterine curettage? Both more or less same, but the anterior vaginal wall, it is very heavy. Can you see the both? The oval shape, it is large in size, the blade, no? It is very large. Okay, in curettage it is the small fenestration. Okay, here there are transverse serration. Here there is no serration. So this is the difference we can find out, that here there is the serration, here there is no serrations. This is large, quite large. The fenestrations are the large. Here it is narrow. Okay, so this way we can handle. Okay, there is in the handle also there is the serration. Here there is no serration on the handle. Okay, so how this is the way we have to find out the difference. So this is the anterior vaginal wall retractor. This is the curettage. A simple curettage. This way we have to differentiate in the exam. Next we will see the Babcock forceps. Okay, so this is Babcock forceps. Okay, as we can see that it has the triangular blade. Can you see the triangular blade? Okay, triangular blade, and there is the fenestration. Fenestration means opening. Okay, so this is very specially designed metallic forceps to hold the tubular structure like fallopian tubes. Okay, sometimes you can hold the appendix, or in surgery you can hold the lymph nodes. So what is the advantage of that? It has no teeth and there is the cup-like structure, so there is no trauma. Okay, it can, and also fenestration is their opening. So extra tissue can bulge out from this. So this is the blade with the triangular fenestration. Okay, joint. That is the shaft, thread lock, and finger hook. Okay, so this is the Babcock forceps. Okay, Babcock forceps. Next we will go to the Pinard's fetoscope. Pinard's fetoscope, it can be made up of the aluminium, steel, or wood also. Okay, so it has two parts. This is the oral part. Okay, oral means this should remain on the nurse's ear, and this is on the abdominal part, on the pregnant mother's abdomen. Okay, so and between it is the tubular structure. Okay, so this is the fetal end, this is the oral end. Fine. So how we are to use? When you just hold on the mother's abdomen. Before placing on the mother's abdomen, you need to just warm it this way. Okay, because this can be very cold if it is still. So the fetus can feel chill. So you just warm and place it on the mother's abdomen, and this here our ear. Okay, so we should not hold like this while listening. Okay, before placing on the mother's abdomen to find out the FHS, you require to find out the lie and position and the anterior shoulder of the fetus, and then you place this way. Okay, firmly, not to hold like this. Directly put your ear here. Okay, very firmly. So with this you can find out the fetal heart sound. Normal fetal heart sound is 120 to 160 per minute. Okay, 120 to 160 beat per minute. So this is the Pinard's fetoscope. Next we will see the umbilical cord clamp. Okay, in pack it is available in sterile pack. This way it looks like this. Okay, this is the open one. So after the fetus is delivered, the baby is out. Okay, and then we need to cut the cord. Okay, so from the baby's side, from baby's umbilicus, we need to keep 3 to 4 centimeter, and then you place this, just clamp it. Okay, it is ready. Do this way, clamp just on the umbilical clamp and you fix it, and then remaining part you cut with the cord cutting scissors. So this is cord cutting scissor. So this is umbilical cord, and umbilicus falls down with 7 to 10 days by itself. Okay, so the cord is having the blood vessel. Okay, earlier we used to tie with the thread. Okay, but there used to be so much complication like bleeding, sepsis, and so on. So now it is available in surgical pack made up of the plastic. Just you open and fix it on the fetus umbilicus, and then you cut. Okay, how much distance we have to keep from the baby? 3 to 4 centimeter. That much distance we should keep. We have to instruct the mother not to pull out, nothing to do. It will fall off by itself by 8 to 10 days. Next we will see the episiotomy scissors. Okay, so it looks like this. Episiotomy scissors. So this is very specially designed scissors used to give the episiotomy during the first stage of labor, when the contraction is at the peak. No, when the contraction is at the peak, when the baby's head is seen on the perineum or the hair can be seen. So that time we introduce these scissors in the mother's perineum and we give the episiotomy. So it has two, from the joint, this angle blades are there. So one blade is not pointed, it is not sharp, the other one is pointed and the sharp. So as I said that at the peak of the contraction, with the support of the two finger, you insert two finger into the mother's perineum and then you give the episiotomy. Okay, and always we have to remember why this angle is there. No? So the episiotomy is always given the medial lateral. Okay, at the 60-degree angle always. It should not be given straight. Okay, specially designed so that in angle, so that always the episiotomy cut is given in the angle, so that no damage is done to the rectum or so on anus. Okay, so this is the episiotomy scissors. Then always one thing we have to remember, scissors always are not autoclave. They are sterilized with the chemical method. Okay, so this is specially designed episiotomy scissors. Okay, so this sharp part with the two fingers supported, we insert into the perineum, and on the peak of the contraction only you give the cut in the mother's perineum. So this is episiotomy scissors. Next we will see the umbilical cord cutting scissors. Okay, very specially designed only to give the cord of the baby. So we know that the cord is made up of the jelly. Okay, water form like jelly. It also has the blood vessels. Okay, so it is slippery. Okay, so with the normal scissors, if you try to cut, it will slip out. Okay, therefore this is specially designed. Okay, you can see the blades are the circular. Okay, when it comes, when you try to cut, okay, the one blade exactly fits on the other. Okay, so there are very less chances that the cord can slip away. Okay, and it makes inside there is a circular. Okay, so exact the umbilicus cord fits here and very easily you can cut. When we try to cut, there are blood vessels, so the blood can flush surrounding even over us. Okay, so you need to protect yourself with one gauze piece. Okay, so these are the circular blades. There is the joint, there is no lock. Okay, and this is the finger here. Okay, so again the sharp scissor is not autoclaved, it is sterilized by the chemical method. Okay, so this is umbilical cord cutting scissors. So Dear students, welcome back to this part 2 of Obstetric and Gynaecological Viva video. So today we will see some more instruments. The first instrument we will see the needle holder. So as the name suggests, this very specific instrument is used to hold the suturing needles. Okay? After giving the incision or in LSCS or in episiotomy, we need to suture up the muscles. Okay? So with this we hold the suturing needle and hand to suture. So this is made up of the stainless steel. Okay? This is the tip with the serration which gives firm grip to hold the needle. That is the joint. And that is the thread shed lock and finger. Okay? So this is the suturing, specially used to suture the anything, muscles or episiotomy. Next we go to the towel clips. Okay? As the name suggests, okay, this is used very specially in surgical field while before doing the surgery or operation. The surgeon prepares the surgical trap. So to fix the surgical trap, okay, with this towel clip you can just fix the any trap that is placed. Also you can fix with this the diathermic cables, okay, or suction cable. So these are the towel clips. Okay, it fixes the towel or the trap on the surgical clip. Next we will see the cheatal forceps. Okay, cheatal forceps. So this is very specially designed forceps. Okay, heavy metallic instrument. The tip, okay, as you can see, the tip has the serration. So this serration gives a firm grip to hold anything, to pick up anything from surgical sterile field. So always during surgery or in the dressing trolley you want to pick up anything. In surgical field you can't pick up anything with our hands, correct? So this instrument very specially used to pick up during surgery from the drum. Either you want to pick up any trap or any sponge, any gauze, whatever instrument you want to pick up and give to the surgeon. So with this we can use this cheatal forceps. Always used dipped in the antiseptic lotion this way, okay? Because the tip of that always remains sterile. Okay? You can never touch this field, always it is sterile. So that's why the sterile instruments we can pick up with this. So this is the cheatal forceps. Next we see this is the Doyen's retractor. Okay? The retractor itself is used to retract the muscles. For example, in cesarean section, okay, the surgeon gives the incision on the abdomen, so you need the abdomen muscles to retract, okay, to view the uterus or any part that is being operated. So this specially designed, okay, to retract the muscle so that it gives a better visualization of the part that is going to be operated. So with this you can view properly the part that has to be operated, and also the trauma to the muscles is minimized because it gives the clear vision, clear picture of the part that we will use. So the parts, this is the curved blade, okay, and this is the handle. So you can come properly or firmly with this handle. So this is Doyen's retractor. There are also many other retractors used in the surgery. Next we come to the forceps. Okay, these are the forceps. So these what I am holding, this is the Wrigley's outlet forceps. Okay, what is the name? Wrigley's outlet forceps. So this is most common forceps that is used. This is made up of the stainless steel. Okay, so this is 11 inches long, and it has the cephalic as well as the pelvic curvature. The parts, these are the curved blades. Okay, so these are the blades, and this is the shank. This part is known as the shank. Okay, here is the joint. There is no lock but just the joint. And what I am holding, this is known as the handle. So handle, joint, or you can say lock. This is the shank and this is the curved blade. Okay, curved blade. So it is used to deliver the fetus, especially face presentation, and also in direct occipito-posterior presentation, and in cases when the mother fails to deliver the baby with the head crowning at the perineum. Okay, so it also is used in a mother, okay, with a heart disease. So she gets so exhausted at the table and you want to cut short the second stage of labor. That's why you just pull out the baby with this forceps. And indication is maternal exhaustion to cut short the second stage of the labor or when the mother is in distress. Okay, so this is the Wrigley's outlet forceps. What are the complications when we use this? So the baby fetus facial laceration can occur, or facial nerve injury can occur, ocular trauma or skull fracture, and intracranial hemorrhage also can occur because this is placed on the fetus forehead and the skull. Then also for mother, perineal laceration can occur, vaginal laceration can occur, and hematoma can be formed. So this is Wrigley's outlet forceps. Next forceps we will see is the Killian's forceps. Okay, so this is the Killian long straight forceps. Okay, Killian's long straight forceps. So Christian Killian designed this forceps to facilitate delivery from mid pelvis in cases of the malrotation, when there is malrotation. Also in occipito-posterior position and occipito-posterior position of the fetal head. Okay. What is the difference between the Killian's and this Wrigley's forceps? Okay, so Killian's forceps are designed for rotating baby's head, okay, during delivery, especially when it is less favorable position. Okay, and this Wrigley's forceps are used for low or outlet delivery, okay, where the baby's head is already well descended and closer to the vagina. Okay, so these are the difference. So the forceps are used in the right person and at the right time. Okay, next we will see this is the venous cup. Okay, venous cup with the traction. So as we know that it is used in alternative to the obstetric forceps. When the forceps, the chances for the injury is much more. So in alteration to that we are using this. Okay, so the part is the suction cup. Okay, so this is the cup. This is applied on the fetus head, and then this is the vacuum connector. Okay, with this we connect here the suction tube. Okay, and this is the vacuum generator. So the cup, okay, and here the suction tube we join here. So the indication when like forceps, when the maternal exhaustion is there, okay, the mother gets so much tired she cannot bear down the baby, then we are using this. Also maternal distress and in fetal distress also we use this. Advantage, it can be applied even when the cervix is not fully dilated, that is the advantage. And also over the forceps this causes much less injury to the baby, and injury to the vaginal wall also is minimized, much more lessened. Okay. And what are the complications? It can form hematoma for baby, cephalohematoma, swelling on the skull, and superficial scalp wound can arise. Okay, so this is about the venous cup. Okay, we can say vacuum delivery. Okay, so this. Next we go to this is the copper T. Okay, as the name suggests, it is the T-shaped and inside the copper is used. Okay, so this is also known as the intrauterine coil. So this is always available in sterile pack, and this is free available at all the government sector Insertion also is being done either in private or government hospital. In government hospital, they do not charge anything. This is free available. Okay, so it is copper with the copper available in T shape. Okay, as you can see in the pack, T shape. So the parts, the copper T, as you can see, this is the copper T type copper T, and then there is the plunger. This is plunger. Okay, and the blue rod, that is known as the flanger, plunger, and copper T. Okay. How does it act? So this is one of the most effective for the birth control. It is easy to insert and easy to remove also. So one of the device, it is, once the device is placed in the uterus, it can be kept up to 12 years. So it is effective to prevent pregnancy for 12 years. The effective rate is more than 99%. Okay? In 100, only one lady, one woman can become pregnant. There are chances of pregnancy even after placing this. So, but 99% it is useful. And then it can, the copper T, how does it act? Okay, so this copper T releases copper ion, that is the copper. So this ion is released into the uterine area, so which works as a spermicide. So this copper becomes spermicide, which kills the sperm and thus prevents the fertilization. Okay, so there are also medicated copper T and non-medicated copper T. So the medicated intrauterine devices releases the form of hormone progesterone. Okay, so if it is medicated, what it will release the progesterone, and this progesterone, it thickens the cervical mucus. Okay, it thickens the cervical mucus, making impossible sperm to enter or to reach the egg, and thus the pregnancy is prevented. So the types are copper-based, non-hormonal or unmedicated, and the second is the copper-based, hormonal-based or medicated one. Okay, what are the side effects when the woman puts this? Okay, so that time it causes abdominal cramps, then back pain initially, and sometimes it can fall out by itself also. It can also cause endometritis, then also it can cause spotting or bleeding. Is most common for first few days. Also it can cause the ectopic pregnancy. Okay, so these are the side effects. What are the contraindication when we should never put this? So when pregnancy is suspected, okay, or suspected, when there is anemia, when there is uterine fibroids are there, any malignancies that in those cases, this is contraindication, it should not be. Okay, so that's all with this table Viva.